wanted to ask everyone who joined to possibly provide me with their name and what urban Indian health program or organization they represent.
Hi, I'm Madison. I'm with the Native American Development Corporation and the Billings Urban Indian Health and Wellness.
Hi, Madison. Thank you for joining, and I appreciate you sharing a little bit about yourself with the rest of us. Is there anyone else who would like to share their name and what urban Indian health program or organization they represent? Okay. So if no one else has is able to provide their names, welcome to the Behavioral Health Community of Learning on Best Practices for Grant Writing series. Our first topic today in the three-part series is on planning for data collection, performance assessment, and an evaluation of behavioral health and related programs. My name is Sebu Kimjan. I am the Public Health Associate in the Technical Assistance and Research Center at the National Council for Urban Indian Health. Um, as an overall guide to the National Council Urban Indian Health's Community of Learning model, it is based on the knowledge that you, as the Urban Indian Health staff or representative of your organization, are able to bring your practices and successes to the table to assist other peer Urban Indian Health program staff and other organization staff uh, together. Therefore, we invite you to provide feedback and share as you feel led so that we can all grow and learn from each other. Today, we would like to share with you briefly some important best practices before opening up comments and questions. This community of learning will not be covering all steps in the grant writing process, but we will try to highlight areas that seem to be most challenging when shaping a funding request. Although there are many types of funders, such as foundations, corporations, federal agencies, uh, most all require similar information, even if the length or the formatting varies from proposal submissions. As I mentioned, today's topic will be focusing on planning for data collection, performance assessment, and evaluation of behavioral health and related grant programs. I would guess that many of you know and have possibly utilized planning methods for data collection and evaluation. But when planning for data collection and evaluation, it's really significant to have a plan of action, to understand your steps in developing an evaluation plan to address the problem you're seeking funding for, whether it be for a suicide prevention program on college campus or implementing integrative care at a residential treatment program. There should always be a plan of action. Without it, or a well-written one, in some cases, your proposal will more than likely fail in meeting passing grading standards. So before I move on to introducing my presenter, I wanted to let everyone know that the scheduled dates and times and topics for the rest of our community learning grant writing series has been sent out. We will also be sending invitation details to part 2 of our best practices for grant writing on successfully responding to a project narrative. If anyone knows of work colleagues or new staff in your organization that may benefit from our next community of learning, please forward your calendar invites to them. Um, With no further ado, I want to present our presenter, Dr. Jamie Barges. Dr. Barges has spent her career working for tribal and urban Indian communities across the United States. She was the project coordinator for the Indian Healthcare Resource Center of Tulsa Circles of Care grant from 2005 to 2008 and has served as an evaluator consultant for several other Circle of Care grants. Her previous role as the director for the Technical Assistance and Research Center at NCUI provided additional opportunities to share lessons learned from the Circle of Care grantees. She is well known for promoting community-based participatory research projects to advance health knowledge and practice, and she's the owner of One Fire Associates. So with no further ado, I'll pass the baton to Jamie, Dr. Barges.
Thank you, Sabu. I really appreciate the introduction there. I think you were reviewing my bio from the NCUI conference, which I presented on Circles of Care, but that's one of the grant programs I've worked on. There's quite a few additional grants that I'll talk a little bit about today. Welcome everyone. I'm happy to be able to spend some time with you here today to prepare you all as you're embarking in developing evaluation and performance assessment plans for proposals for your organization. I am President and CEO of One Fire Associates, and I work primarily with tribes, urban Indian health organizations, and some universities to really support the building of research and evaluation capacity. And while I work in a number of areas of health, my passion and area of specialty is in suicide prevention and also in the healing from historical and intergenerational trauma as a pretty root cause for the suicide epidemics that we've been facing in many of our communities. And certainly those things are tied to substance abuse, which many of you all may be working towards proposals that address those kind of co-occurring issues. Again, I serve primarily as an external evaluator on a number of not only SAMHSA grants, but grants through other state and federally funded efforts. And I'm here today certainly not to give you an exhaustive overview of this topic because we only have a short period of time here today, but to at least give you some snapshots and things that would, and additional resources that I'll provide at the end that will help you as you're writing your section on evaluation performance measurement. So first, I want to talk about the goals for today. First, I really want to show some culturally relevant models that it's very important to have some culturally relevant model that's going to help guide the work that you're doing when it comes to performance assessment and evaluation, and this is important for many historical reasons. We're also going to talk about basic steps to help you develop your evaluation plan, as well as linking to resources to support you in that journey. We're also going to talk about common evaluation methods. We're certainly not going to get to all of them because there's many evaluation methods that could be used. We'll talk about how to select evaluation tools, and I'll have some resources for you there. Hopefully those tools are available, but if they're not, resources for how to develop local tools. And then finally, some tips and, again, the resources that we'll provide at the end to help you with your process. So for me, I only use models that engage communities in an active and equal way. So the model I generally use is community-based participatory research. And I always like to start with this when I'm talking about culturally based models, because it's very powerful and effective in supporting community members to own their data and to use that data for decision making. And I always tell this story when I was working at the Indian Healthcare Resource Center in Tulsa, and we were running a Circles of Care project. We had a community member who was kind of a naysayer and was really skeptical of what this data was going to be used for and what was going to be collected. And I think he showed up just to track us and make sure we were doing all right at the community advisory board meetings. And somewhere a couple of years in, after we had collected data, brought it back to the community, they really used it to try to think about how to plan services in the Tulsa area. This gentleman said, if you look at our data, and I don't really know what he said after that, because I was just jumping for joy, because one, he recognized that that was community data, and not only that, but he was using it to help think about decision making to help solve some of the issues that the local community is facing there. So after I had that experience there in Tulsa, I was really hooked on the importance of involving your community, particularly for tribal and intertribal communities where there are a lot of cultural factors that weigh in when it comes to collecting research and evaluation. So I'm not going to talk about all these models today. I will talk just briefly about community-based participatory research because that is a model that I employ mostly. However, there are other models that are equally good. Participatory action research is a great model that has similar tenets to CBPR, community-based participatory research. Tribal participatory research also, respecting tribal sovereignty, that's another really good model, and all of these are fine, culturally competent models that you could use to guide your research and evaluation data collection efforts. So just briefly, CBPR, the model that I use, is really focused on creating an equal partnership between the scientists and the community. It really builds their local leadership, their capacity. It's really a workforce development model because it's really about training and engaging your community to do a lot of the evaluation work as well as to interpret that data and use that data for good decision making. So you see a lot of workforce development come out of the model. And certainly there are lots of resources online. You can Google any of these models and you'll find lots of resources available to help you understand more about the tenets of the model. So I'm also going to talk about some steps that you can take to developing the evaluation plan. And certainly there are many other steps you might take, but this is just to give you a framework to begin your efforts as you're building your proposal. So the first step is really to look at what the grant requirements are. And as if it's a federal grant, and I'm primarily talking federal grant here, but I will diverge and talk about state or other kinds of funding. But if you are going after a federal grant, let's say a SAMHSA grant, you'll likely see that there are national outcome measures that are required that you have to collect. And the question is, when you're collecting data with human participants, there are some special steps that you have to take, and we're going to talk about that in a little bit, but you have to really look at what is exactly are you being required to do, and are you required to collect data from human participants as an initial review of your grant proposal there, or the RFA. The other thing is that you'll likely have to report on infrastructure development, prevention, and mental health promotion indicators. But these are called IPPs that are entered into SAMHSA's data system called SPARS. I have a resource that I want to make sure everybody knows that it'll be provided at the end of this that gives you the overview of indicators guide. So I'll make sure you all connect with that. But you'll want to look at, there's hundreds of these indicators, and you'll need to see which ones the grant you're writing to is preparing to track. And then there may be other requirements for grants. Some grants may have a national study that they require you to participate in. They may have other kinds of methods that they're using to try to evaluate the grant program. So make sure you take a look at that and see what's being required there. And then the second step is really, after you really have a good review of the RFA to know what's required for the project, then this is where I think consulting with your major stakeholders is really critical. And don't forget those stakeholders may be youth, and it is very, very, very important that if you're writing for youth applications to serve youth, that the youth are helping you in the development of those goals to make sure that they're going to be meaningful for them in their lives. The same as if you're serving families or serving adults, try to involve the most important stakeholders, the one who's receiving the services from you. So I'd encourage you to help engage them as you're thinking about developing SMART goals. And I'm not going to go into all the SMART goals, but if you haven't learned about SMART goals, certainly research that, because it's a great way to learn how to set goals that are specific, measurable, achievable, relevant, and time-bound to make sure that there's something that can be accomplished. Okay, here we go. So then the third step is really around conducting a local assessment of your organization or the system network of people that you're working with, because you might be working within a network of organizations or tribes or combination of those things. So it's important to conduct that assessment to figure out where everybody's at in terms of their evaluation capacity. And I've listed a number of questions up here that you can, you should be asking yourself. But I do want to just also add that, really it's about what data do you currently have available to you and what data do you not have that you really need. So this could be an opportunity as you're thinking about, data that you have. Do you have an electronic health record? Are you using RPMS as a patient management tool or as the EHR piece of that? Also, do you have a strengths and needs assessment? Has that been conducted in a while? And I'm not talking about a strengths and needs assessment where we're just pulling RPMS data. And I'm not saying that can't be helpful to pull that, but in terms of thinking about the real strengths and needs from a cultural perspective of your community, have those strengths and needs assessments been done. And then the other is the community readiness study. You might ask yourself if you've conducted that study for whatever issue it is that you're targeting. And I'm going to talk a little bit more about the community readiness assessment in a little bit here. So step 4 is really for you out now that you understand what the RFA requires. You've really kind of set some goals for your SMART goals for your project. You have done an assessment to know what your kind of capacity is. Then the next step would really be to set what your capacity goals are. And actually, you probably would do the assessment before maybe you set the goals, because you might want to actually make a capacity building goal one of your actual goals, like expressed written goals. And I would advise that particularly when you want to make sure that your grant monies build something sustainable that can last. The more you focus on capacity building, the more likely you're going to be able to leverage additional funds and resources. So I would highly recommend that any application have some evaluation capacity building goals, because that really can come back to communities in wonderful ways. So there's several ways that different capacity building goals that you can set, and I've provided a few examples here. And then at the end, I'm going to give you a few snapshots of some real projects and what the capacity is and what kind of goals they set for themselves. And some of them did set some capacity building goals. So you'll see examples of that in a few minutes here. So I'm going to take a little, before I talk about step 5, I'm going to talk about, this is one of the big issues that comes up when you're writing for funding proposals and there's required evaluation activities, is whether or not to use an internal evaluator or an external evaluator. So I'm going to talk about the pros and cons briefly of both. For external evaluators, certainly the pros are you're getting professional products delivered, and that's what, ideally is the best it's going to be. It also provides an external observation of work. I'm really amazed by how many times I've heard from community members, staff, even leadership that says, we've been saying this forever, but you show up and back up that statement, and now everybody is interested in it. And I think it has to do with this perceived objectivity, and also you're an external person that can reflect back, and you're not a part of the internal political challenges. So in many ways, the use of an external evaluator could support community members, staff, and leadership in leveraging change at a policy level. So that is definitely one of the pros to having an external person. The cons, certainly it costs more per hour than what it would be to hire a full-time salary person. So that is a big con for the external using an external evaluator. I also say that unless a capacity building model is used, like community-based participatory research or others, then you may not be building local capacity if you just pay an external person to do it and send you back the report. I wouldn't recommend that model because it doesn't do much to build your local capacity there, which I think is really of the utmost importance. And then the other con about it is it requires collaboration with an external person or persons if they have a team of folks, which can, it takes a little bit more time and requires more effort to connect. And related to that, they're oftentimes not in the community all the time. Generally, they will come to communities, external evaluators for site visits on a regular schedule, so they can keep up with what's going on and meet with youth and families and other stakeholders. But they aren't there all the time, so that's one of the cons. Regarding internal evaluators, oops. Oh, I think this is a mistake on the slide here. So this is internal, should be internal, not external here. To use an internal evaluator or not, here's the pros. If you hire someone internally, you can really support building internal capacity. Things move quicker usually because you don't have to consult with an outside person, and they may be able to move things more quickly because they know the system. And certainly it's generally cheaper, particularly if maybe you've got a few grants and you hire one person to help manage across those grants. Now, once in a while, you may be going after a $1 million or multi-million-dollar grant that would allow you to hire evaluation staff just under that grant, but usually you would have to do kind of a high, kind of work across grant programs to get a full-time evaluation support staff. The challenges really is around how difficult it is oftentimes to hire someone with the kinds of evaluation skills that you really need to do the work in a full-time capacity. Generally, people that have expertise in that area do not take positions with a single place because they're expert providers of services to multiple communities, and it would be, most of them would not take a full-time position. Now, if you're in a wonderful, urban area and you've got a lot of resources and things built out, you might be able to recruit a highly skilled evaluator to work on your team, but it's oftentimes difficult. And generally, you have to get someone with maybe less professional experiences or skill sets, so the training costs may increase. The other thing is really around perceptions, and perceptions do matter. And I always say it's a perception because, objectivity is really a little false, right? Because everyone has a lens that they see the world through, and whether that's an external person or an internal person, but it is a perception of that folks that are internal would have a lack of objectivity because they're a part of the system, and it's also them, maybe protecting their role or other things. So those kind of perceptions exist, as well as the perception that an internal person may have limited thinking outside the box. And indeed, when you are working within one system and you only see one system, you may not have a lot of models to draw from. And that's one of the things that the external evaluator does, is sees a lot of different models. So there's a lot of opportunities for us as external evaluators to connect you with other peers that are doing similar things, so you can learn from one another and get all these wonderful new models and ideas. And then the other challenge with the internal evaluator is internal political challenges. Oftentimes, folks that are internal have very limited ability to deal with the political challenges that might exist. I am more of a supporter of a hybrid model. Ultimately, I would hope that every urban Indian health organization in the country has a fully functioning research team with a doctoral level researcher and building lots of workforce capacity. And until you get to that place, these hybrid models can be very useful in both building your internal staff capacity while using expert evaluation support externally as you're building that capacity. So we're going to talk about a few models in a minute here that will show you what these kind of hybrid models can look like, and they do vary tremendously based on the capacity of the particular site. Okay, so now that you have an idea about what your capacity is and what you're going to be, what your capacity goals are, then it's time to start thinking about developing your required evaluation plan. And so here's just some of the questions that you want to be asking yourself and answering. It's certainly not exhaustive here, but thinking about how are you going to collect those infrastructure measures that the grant requires you to collect. If it's SAMHSA, it's called a IPP, the Infrastructure Development Prevention and Mental Health Promotion Indicators. If you have another grant, those indicators may be called something else, but it's basically what are those those required things that you have to collect across all the grant programs. And then also, if there's required grant data, that you have to collect from, particularly from youth and families, you want to think about those extra steps around protecting human participants. Generally, those grants require you to submit an appendix that is about the protection of human participants and what your plan is to address that. And usually that has to go in as an attachment. I do have 2 examples of those that are provided in the resources. I oftentimes get calls from communities asking if I have an example of what that looks like and what is expected. And then I also include some resources for you to think about, what are some things that could impact, SAMHSA coming back and saying, hey, you're not really addressing this very well, or we have concerns. So some of those resources are in there for you. And then I would also share that if you are collecting data from human participants, it's possible that you would need an institutional review board or IRB monitoring board that reviewed and approved and monitored your data collection from community members. So generally, if you're not sure whether or not that's the case, and the grant does require you collect data from youth and families, I would just advise that you write in that you're gonna you would utilize the institutional review board at whatever agency you've got access to one. If you don't have access anywhere and you are an urban Indian health organization, then you can use IHS headquarters. I've seen that happen before. Some of the tribal epicenters are really helpful to urbans to allow them to use the area IRB, but some are not. So I've definitely seen there are some areas where the tribal epicenter that has an IRB in the area does not allow the urban Indian health organizations to submit proposals or IRB studies there. So in that case, you should be able to use IHS headquarters, and I would just write that in that you would go through that process to see whether or not you were exempt, or if you needed to have an IRB, monitoring board for the data that's being collected. And that should, suffice until you can figure it out. Okay, so, sorry, it's not progressing correctly here. Okay, so then the 6th step is really developing your local evaluation plan. And so really this is thinking about how are you going to be evaluating the goals that you set. It's really important that you think about measurement. And so if you have a goal, being very clear about how it's going to be measured, what methodologies are going to be used, what tools are going to be used. And I'm going to give you some resources for this, and we're going to talk a little bit about these things. Who's responsible for collecting, analyzing, aggregating that data, and really very important is when's the data going to be reviewed and by what audiences? And it's really important, I think, that those are built into the proposal so that when the staff get these, they see that is really important that the data go back to the various audiences, because if you just collect data and it doesn't go anywhere, then it's not going to be used to make change or to grow and expand the program. So I think that building that into your local evaluation plan, that there are feedback loops to various audiences. Those audiences may need to be county or state officials. They may to develop partnerships. They may need to be to your board of directors. They may need to be to area tribal leaders, also to youth and family. Don't forget them, and individuals that you're serving if they're adults, who it is you're serving. They're important audiences, and make sure that those are written in so that feedback loop is expected and it's there. And then finally, the quality improvement piece, really it's important that you have some kind of QI process and write that in. How are the QI decisions going to be made? And I think most importantly around community quality improvement is that there's some way to gather community input in an ongoing basis. There's an ongoing mechanism for which you can share data and get information back from communities to help inform your decisions. Otherwise, we're making decisions without that youth and family or community voice, and we run the risk of creating strategies that don't work. So I think that part is really important, whether that's a community advisory board or a youth council or a combination of those things. Think about how how you can get that community inputs to support the quality improvement piece. And then also think about, again, building up how the data can be used to help expand the capacity or to support policy. Many of these grants are small amounts of funds really in the grand scheme of things, and so it's very important that that data be a tool to support sustainability efforts. And unless those mechanisms are built in to your proposal, then it might get lost when it comes to implementing it if it's funded. Okay, so here's some common evaluation methods. Certainly this isn't exhaustive, but oftentimes projects will require at minimum a process evaluation, so that you're evaluating the process of implementing the grant, and also kind of evaluating how you're meeting your goals and objectives of the grant. You may have specific process evaluation questions that you want to ask, and there's lots of different types of process questions you could ask. It could be around engagement of your community, how well you're engaging them, or it could be participation by your external partners, or other things that you've targeted as things that you should improve or focus on in your community. And I also said earlier that I would talk about a little bit about the community readiness study. If you all have not done a community readiness study, it is a really effective and simple evaluation tool that can help you assess the general readiness of your community to change on a target issue. There's a number of community readiness study models, but the one that's been developed by Indian country, for Indian country, so to speak, is the tri-ethnic community readiness model by Dr. Pam Jumper Thurman and Dr. Barb Plested. This is a really excellent model. You can Google tri-ethnic community readiness model, and you should be able to get the full manual online. And certainly you could reach out probably to the technical assistance folks if it's awarded to get help in learning how to do it. But if this is a great tool to build in, because unfortunately what oftentimes happens is if we're not really connected to what the community culture is and context is and where the leadership is at, then we can build a grant and say, oh, we're going to do these things, but it may not match the readiness of your community. And if you build strategies that don't match the readiness of your community, then you really run the risk of it not working because the community is not ready for it. So this study allows you to kind of get the pulse of your community on a topic, and that topic could be suicide prevention. It could be, I've seen people do it on addressing historical or healing from historical and intergenerational trauma. I've seen communities focus on a positive topic, readiness to change wellness in the community, or readiness to improve wellness. So you can use a wide variety of target issues, but it's very effective in getting that snapshot and then helping you work with your community to develop strategies that are going to move the community to becoming more ready to meet that. So that's a great tool to build into an evaluation plan. And certainly if you haven't had a community strengths and needs assessment done in a while, and this is again beyond your EHR data or your RPMS data, really looking at how well you're building you understand the strengths and needs from the community perspective. And then there's several other kind of examples of different things methods that you might build into your plan. So with selecting evaluation tools, it can really be difficult sometimes to know, but if your proposal requires that you select evaluation tools, what I always encourage is that you start with the outcome or construct that you want to achieve. So what's the outcome that you're hoping to increase? So with some project, it might be, we're working with these youth that are transition age youth, and our goal is to improve their hope for the future. So that we can prevent suicide and other things, and our goal is to, improve their connection to their culture. Well, then you're going to want to look for tools that measure hope and measure cultural connectedness. So those are just a couple of examples. And then if you don't know of tools already that you want to use, this is where you have to kind of do the scouring the literature to find possible tools. The first thing you want to ask when you're looking for those tools are they standardized? In other words, is there some psychometric properties that can be reported on them, which means, do they have reliability and validity? So that would be one of the questions you'd want to ask. The second is, have they been used with tribal or intertribal populations? That's also very important because some of the tools as standardized aren't culturally appropriate, and they have to be tailored if they're going to work and not be offensive or incorrect for that community. And then also looking at the cost, because some of them can be quite costly. I tend to look for tools that are free so that we don't have to get our community in debt to the tool developers for the rest of their time in using it. And then if you have to develop your own tools, because whatever it is you're trying to measure, there's just nothing for you, then it's really important that you develop and test those tools kind of as a last resort, because it really takes a lot to develop psychometric properties on a tool. And so you don't know for sure whether or not it's reliable and valid unless you were to do that. So that would be kind of the last resort there. So I'm going to give you a few tips, and then we're going to open it up if there's question and answers, or if people want to share things that they've learned are really helpful in this process or resources that they know are very helpful, then there'll be opportunity to do that. So the first is, I know people kind of maybe like, oh, logic models. Some people love logic models. Some people do not love logic models. But it is an evaluation tool, and it is important that you develop and use a logic model. And when I'm actually working as an evaluator on a grant, we take a look at those logic models. We try to do that once a year, revise them, update them, disseminate them, make sure that everybody knows this is what we're working towards, because it keeps people on focus. And oftentimes when you're running a community project and there's all these things you need to do, it can be easy to get off track. So these logic models are a tool to keep everybody on track. But one of the things that I have concerns about with logic models is that they have become way too difficult. And I always say, if my grandma cannot understand it, then we need to revise it so that my grandma can understand it, or a young transition age youth should be able to understand it. So there's a wonderful little logic model guide that is called Ideas into Action, and it was actually developed out of the University of South Florida, the Florida Mental Health Institute, and it's very simple so that youth and families can understand it, and it was developed for children's mental health. So I have that as a resource for you all. That's a wonderful little tool. It's even got worksheets in the back to help you develop your logic model if you're having trouble thinking about how to put all the pieces together. And I highly recommend that as something simple, and it's not so complex with all these boxes that don't seem to connect. And then the second thing I told you, there is an IPP overview of indicators guide if you're going after SAMHSA grants. Go in there and get a sneak peek of the IPPs that your grant is supposed to measure, so you kind of know what they're expecting in terms of measurement. That's something I generally do, because there's hundreds of those IPPs and each grant selects certain ones. And usually it's in the announcement which of those indicators you're going to have to measure. And so you can kind of get a sneak peek by going into that. And I've got a link there for you on the resources sheet that we're going to be providing after this presentation. And then finally, SAMHSA put out a guide for developing a competitive grant application. And there's lots of examples in there of all kinds of things. That's where you'll find, here's some examples of, in the Protecting Human Participants, of reasons why SAMHSA would kind of push back and say, hey, we have concerns. So there's a lot of really wonderful tips in that book, and I would highly recommend you take a look at it. It just came out in this year, so that's a new guide, and I suspect it would also be helpful for developing competitive applications, maybe for other grants and other agencies and maybe even state or county other kinds of grants. So those are the things I wanted to share. And again, I have a few quick examples here. These are samples of projects. I'm not going to share which community it is, but just generally these are, and it's certainly not exhaustive of everything they're doing, but it gives you a kind of a snapshot of the different kinds of models. For this particular project, this is a Partnership for Success community. They really didn't have a lot of evaluation capacity. There was no EHR. Data had to be manual. They never really collected any data much beyond some community surveying that they did. So they contracted with an evaluator to support the data analysis and reporting, and also to train their staff, youth, and family members in how to collect and aggregate the data. So the community is taking on that piece. And then their local evaluation plan is they started collecting pre-post assessments, which is the first time they'd ever done that for the youth interventions that they're doing. They also are supporting an annual sample survey because they're in a community where there is no state or county data to support tracking of epidemiology data. So they've been measuring, they've been focusing actually on sobriety, and then they flip the numbers to send it to SAMHSA about how many people have been using the last 12 months or 30 days or whatever those indicators are. So this particular community has been tracking sobriety and honoring and valuing that as a positive outcome in the community. They also are meeting with the evaluator 2 to 4 times a month for the process evaluation and tracking, and also for quality improvement work. And then they actually set a capacity goal to select and onboard an electronic health record. So that was one of their actual goals that they wrote in to support capacity. And here's a second community who is also Partnership for Success, because I wanted to show you how vastly different they could be in terms of what they're doing. So this particular project has actually been implementing community-based participatory research for a long time. And so they really built up a local workforce, and they do have one full-time evaluation staff person that is responsible for a quality improvement team and to also help with them with the grant tracking and reporting. They do use RPMS to track service, but they don't really have a EHR at this point. And they contract with the evaluator to provide training, data analysis, and reporting support to their existing workforce. They also use a shared space to support activity tracking, and they're able to report by staff across multiple funded projects. So they've really got a little bit of capacity there internally. And then, for this particular community, they're using youth and community advisory boards to help guide the direction of the activities, and they've been actively involved. They're actually targeting health indicators using county data because that county data does exist for them. So for their epidemiology piece, they're actually tracking using county data. They're also conducting meetings, quality improvement meetings, and they meet 2 to 3 times a month as a team with the evaluator to support the process evaluation and the quality improvement activities. And then they're doing pre, post, and 6-month follow-up assessment interventions with their youth in their programming. And finally, they focused as a QI goal in evaluating fidelity to the interventions to ensure that they were giving quality, effective services. And so they're using a number of tools and actually developed a tool and refined that tool over pilot testing to help track fidelity to some of their effective interventions. And then Garrett Lee Smith, this is another example. This is a community that's very sophisticated. They actually have a whole evaluation team. So in this model, the contracted evaluator serves as an expert consultant to the leadership staff and partners who are really doing all the work. So this is you got a little bit of expert consultation, but it's most of the work is being done by the community. Again, they're using advisory committees to help them to make sure that they're implementing a community-based approach. And they also leverage external partners to help with some of the data analysis. But the rest of it they're able to do internally. So this is a more sophisticated community. And then finally, here's an example of a community that has no EHR. They've never really done anything before. They don't have experience in managing any federal grants. They don't have any evaluation workforce, so they have contracted with an evaluator to help build their capacity. And their QI goal is just to develop a process and tools for tracking grant data because they've never done it before. Certainly they don't have an EHR yet, but they're not there yet. That might be a capacity goal that they would develop in the future. And with this particular one, they're meeting with their evaluator 2 to 4 times a month for process evaluation, and they're meeting quarterly because they're really focused on policy advancements. And I know I shared that before, but it's very important that the data be used somehow to support those policy advancements. And writing that into your application is a great way to reinforce that happening. Particularly with a grant like Native Connections, it's such a small amount of money that you could go out and hire a coordinator or someone that's doing, full-time prevention in the community, but what happens when that grant ends? So the more you can, build up the evaluation capacity, the data feedback loop, the more you're going to be able to leverage other resources, other dollars, other partners, and you actually have the ability to take a small amount of money and turn it into a lot. So I would really highly encourage you to include those pieces. Okay, so we have about 10 minutes left, and we have an opportunity. I'm going to turn it over to Sabu to manage the section, but we have the opportunity to ask questions or to comment on your own experiences.
Thank you, Dr. Vargas, for leading our part one of our behavioral health community learning, best practices for grant writing series. So with that being said, leave it up for the participants today. What are some of your best practices in preparing for grant writing that you would like to share with one another? Or what are some ways you've planned for data collection, performance assessment, or evaluations? Or what have been your successes in building a data collection, performance assessment, or evaluation team? Either one of these, if anyone had some best practices or some experiences that worked well for their organization, it'd be great to hear from you. So, if just to ask one more time, is there anybody that wants to share something that might have been useful for their organization? Okay, so with that being said, I would like to thank Dr. Barges again for leading part one of the Behavioral Health Community of Learning Best Practice Series. We also want to thank everyone who joined. But before you leave, I want to give some reminders, some important reminders. Part two of the series will be on February the 7th. There will be invitations sent to everyone. Please, if you have any staff members or new staff that might benefit from this community of learning, please join and send it to them as well. So the second one's on successfully responding to a project narrative for a grant, and also with participating on this community of learning, we're going to provide everyone with a few documents that have resources that Dr. Barger had mentioned in her presentation, as well as a copy of this PowerPoint presentation in PDF form, and a link to a survey, a post-evaluation survey that will better help us find better ways to support and improve future community learning webinars for our members and for the greater community. And lastly, I just wanted to mention, if any member organization had any questions or on technical assistance or needed support, the TARC department at NCUI is here to support urban Indian health programs with technical assistance and training across Indian country. We do this by providing customized and culturally sound capacity building knowledge tools to help foster and drive changes necessary to advance our community, as well as coordinating trainings similar to one that with Dr. Barges looking and seeking experts in the field to provide support. We also do one-on-one technical assistance for urban Indian health programs to meet their unique and specific needs. So if anyone needs further support from us, here's our contact information, and we appreciate your participation in this community of learning.